Well, good morning, everyone. My name is Sue Ehinger, and I serve as the Chief Experience Officer for Parkview Health. And before we get started with our panel discussion, I'd like to take this opportunity to thank each and every one of you for your commitment and dedication to our community. There's several of you I know that work tirelessly on the topics that we have just discussed. And so we appreciate everything you do as we come together, what a difference that we can really make. I really like the comment about the walls. And clapping. Forgot, yeah, we're a little slow, but thank you, Dr. McMahon. I knew you would get that. Really coming together, this is what I see the Alliance in talking with Brian Mills. They'll start tearing down those walls and barriers. Together, we can really make a difference. How amazing it is, all of our speakers, the Giaquintas, Dr. McMahon, Dr. Sutter, that was in the invitation. Please do so. We really want to hear from you what you believe the greatest concerns of health issues are to you personally. I'm going to talk just a couple of minutes about what our community has shared with us. And also there's some paper in your packets today. We are going to have a few minutes at the end of the panel discussion for questions that you might have for the panelists. So please write those out as we're going along. In 2016, Parkview Health engaged with the Indiana Partnership of Healthy Communities to do a community health needs assessment. What you see in front of you are the results of what our community said are the greatest health issues. But we all learned a lot more from that than these are the top issues. These are issues that Dr. McMahon, you shared so eloquently with us, and the Giaquintas, Marcia, what you've shared with us as well, and the work that you've done. Not anything really surprising. These have come forward year after year. It's how are we making a difference in getting these off of the list. But I think what we learned the most was what we needed to do in immersing ourselves within the community and what individuals said back to us. Yeah, these are the concerns, but where do I get the resources? Yes, I'm depressed, but where do I get the resources? I don't want to walk into the door of behavioral health, the stigma attached to it. Where do I get the resources? Where do I get help? Where do I get the tools? How can you come and meet me where I am? Why do I always have to go somewhere? Why don't you come to us? Meet me where I am. You don't understand what it's like to live in poverty. How can you help me? Those are the things that they're really asking the questions about. How do we give that hand up? How do we have those community conversations to understand what it means to have a safe community? A safe community for me is a little bit different for someone else. There's an incredible YouTube video, and it's called The Left Turn. If you've not seen that, I would encourage you to take a look at it. It's really easy to turn right down your street every day, and you see the same things over and over again, and it's a pretty picture. But if you turn to the left, you might have a different perspective of your own community. I would encourage you to do that, to reach out to people you normally don't talk with, to understand what their life is really like. I wanted to share just a few things that Parkview has been involved in within the community. Won't take too much time to do that, but looking at mental health and addiction. Drug addiction really did not come up on the needs assessment until 2016. We knew that that was a problem, but it really didn't hit our top list within our community until 2016. And it's great to partner with the Lutheran Foundation in that work with mental health and addiction. But one of the things that we have really tried to focus on is suicide prevention. How critical that is to our kids, the bullying that occurs. And one of the trainings that we've been doing is called QPR training. Are any of you familiar with that? We've had incredible responses with that. The training really on how to question, how to persuade, and how to refer. How do I know someone is suicidal or has suicidal tendencies? I was talking with our LaGrange Hospital president yesterday. She was sharing that we've done some training throughout our LaGrange Hospital on QPR. And so the nurse went home and was talking with her daughter about the training, was asking her the questions, and unfortunately found out that her daughter did have a suicide ideation. She's forever grateful for that training. That's a part of an awareness that we as a community can go out and do. Infant mortality. Wow, it's just really so hard to believe that we live in a community today where we're talking about infant mortality. Worse than a third-world country, right? How can we live in that? What can we do? Well, one of the things that we're going to do a little bit differently, because it seems like we've been doing some of the same things, has been engaging community health workers. We have been told, and it's been shared with us, that the community is saying, I don't have support. I don't have the emotional support to help me through times of need. Where do I go? I might be a single parent. Where do I get that support when I need it? I feel alone. So engaging community health workers within our community, where they're involved in their community, they're trusted by their community, as a wraparound service when I need help and I just want to talk to someone, that person is there for them. We think that will make a difference. Obesity, the food insecurity, that's a significant area. If you drive by Beacon and Lake Avenue, you're seeing a building come up. Hopefully now you're seeing a greenhouse part of that. People were asking me questions about, that's an odd looking brick greenhouse. If you don't have food access, which many people in that community, it's a food desert area, do not, then let us help by showing you how to grow food. I'm a farmer's daughter, I know how to grow food. It's the best food in the world, it doesn't taste like canned food. So the intent of that is really to help the food insecurity issues. That people can come and learn how to grow their own food, grow it, prepare it, and have a better life. So you'll see and hear more to come with that. So I am going to do a brief name introduction and have each of our panelists talk about their organization as well as their greatest interests. And then we have lots of questions to ask, and hopefully you will have some too. We have Nancy Kripe, Executive Director with Tobacco Free Allen County, Renetta Williams, Director of Health Visions of Fort Wayne, and Mike Ripley, Employee Benefits Consultant with Gibson. I'm going to ask Nancy if you would start out first.
Yes. Okay, yeah, so Nancy Kripe with Tobacco Free Allen County, and I had all these bits of data and statistics to give you, and I'm like, we've heard so many data and statistics that I'm not going to go there right now, but I wanted to just talk just very briefly about what we do at Tobacco Free Allen County and why I love doing this work. So what we do is work around policy, so smoke-free air law, smoke-free housing policies, smoke-free schools, that sort of thing. That's sort of the macro level work that we do. We also do a lot of work on promoting cessation, promoting the Indiana Tobacco Quit Line, getting healthcare providers connected to the Indiana Tobacco Quit Line and how to refer to it, and also youth prevention. So we do a lot of education in the community. We've done a ton of it this year, going out into schools, to youth groups, to doing the focus on health fairs and so on, to try to get the message out to youth that nicotine addiction is a real thing and is a very serious thing, and that e-cigarettes are not the answer, because they're definitely seeing a distinction between e-cigarettes and regular cigarettes, and they're much more inclined to pick up the e-cigarette than the regular traditional cigarette. They really have gotten the message that traditional cigarettes are a bad thing, and most of them are not at all interested in using them, but they're very intrigued by e-cigarettes. So we have a lot of work to do around educating them about the risks of those and the fact that they are really very intertwined with traditional tobacco. So I love doing this work because I think this is such a key issue. I mean, tobacco use, I think, is our leading public health problem. It's connected to all the others. It's connected to obesity. It's connected to infant mortality. It's connected to the opioid epidemic. I'm not sure how many of you know this, but 90% of people who are addicted to opioids are also addicted to tobacco, and tobacco came first. So it really is the gateway drug. If you are treating the opioid addiction and you're not treating the tobacco, that person is much more likely to relapse. So that's a message we also are trying to get out there to our healthcare providers, that they have to both be treated in the same way we would treat every other addiction. And I think the one thing I wanted to remark on why we have not made more progress in this state around tobacco, one of the things, part of it is funding. I mean, we're not funding it seriously. Anymore. We used to, we're not anymore. Our lawmakers have sort of lost, I think they just took their eyes off the ball. And so, of seeing how important this was. It's like we passed some smoke-free air laws, we made some progress, and then they stopped thinking this was a serious issue. But another piece of it, I think, is that we haven't until very recently seen tobacco use as an addiction, and it is definitely a drug addiction. And we need to treat it with that kind of seriousness and not be seeing it as simply, this is a habit and people have a right to do it, or that's sort of their personal privilege and we shouldn't say anything about it. We need to have the kind of tough love around this that we have around every other drug addiction and not enable it. We need to challenge it and never enable it. And currently we are enabling it with the low taxes that we have on it, with the fact that we still allow people to smoke in multi-unit housing. I don't understand that. I'm like, I do not understand any landholder who allows that. But it's still very common that people living in apartment buildings have to put up with somebody next door to them smoking or upstairs, or and they're getting that secondhand smoke exposure all the time. So that's some of the work we do and why I love it.
Good morning, everyone. My name is Renetta Williams, and I am the director of Health Visions Midwest Fort Wayne, better known as Health Visions. We are a public health organization under the direction of the Poor Handmaids of Jesus Christ. We are celebrating 20 years of service in the community. Health Visions work in the area where most people wouldn't want to work. We work with the most vulnerable populations. We work in those zip codes that you've been hearing about, the 4, 6, 802, 03, 06, and 16. We've been there a long time. And some of the things that we're doing, we find that most people that live in that area, they actually live at or below poverty. And we find that we have about 40,000 people living in that area that's under poverty. Now, in this 06 area, 79% of the people live in that area are at or below poverty. It's a lot of people. And these individuals are suffering from everything that Dr. McMahon said that was going on. These people who live in that area, they have it all. They have the high blood pressure, they have the mental health, the tobacco use, the lack of mammograms, the low number of people being screened for cancer. They are the ones that in prenatal, women entered into prenatal in that first semester. They're the one that have the high mortality rate. And Dr. McMahon told me, when I was reading this, I became sad. And I was like, oh my goodness, the high percentage of adults who are not going to the doctor because, you know what, they can't afford it. The low percentage of individuals who are not getting their flu shots. And even when we try to do the flu shots, the people that live in the area, you know what they tell us? I'm gonna get sick because if I take the flu shot. And these are the kinds of myths we need to dispel because you won't get sick. You will prevent yourself from getting the flu because you need it. We also see homelessness. You see older black men on bikes, they're not exercising, they're homeless, and they don't have places to live, okay? The barriers that we see, when I first came to Fort Wayne, there was lots of factories in the area on the central and south side of Fort Wayne. We don't have those, but we still pay our taxes, but we don't have those type of resources in our area. A lot of people that live in that area do not have the opportunity to even have a work history because there's no work. And training, if we had the industry background, we could train people. They could go to work. The low wages that they have, the lack of insurance, the communication skills. We think the skills are bad now because of the phones and how they're texting. It's going to get worse. Some of the barriers that we're seeing, we don't have the primary doctors in our area. We don't have the urgent healthcare centers. We do not have individuals that want to even educate us on mental health and the stress, all because we live in those 468, 02, 03, 06, and 16 area. And most of all, people have lots of food. There's lots of food, but it's not healthy food. You know, you can go to the grocery stores, but you're going to find potato chips and pop. And so those are the things, accessibility, that we are seeing in the area. I've worked at Health Visions for 18 years, and it hasn't improved. I've worked through my sorority with infant mortality over 40 years, and it hasn't improved. It is time that we put some resources in our community, and we need to improve from $13, okay? We need to do better. So what is Health Visions doing? We have a coalition that we're working with, and that coalition addresses health disparities. Differences that occur because of race, ethnicity, and geographic area that you live in. Those are health disparities. When we first started the coalition, people asked, well, what are health disparities? That was over 13 years ago. And we had to research it, come back and educate people. And when people found out the differences, they're like, oh yeah, that is occurring, okay? So let's see what we can do about it. Health Visions hold town hall meetings around the issue of health disparity. We do listening sessions on opioid, Black infant mortality, tobacco. We have community health workers that we actually do self-management of diabetes. We educate them on eating healthy, classes on obesity, mental health. We partner with local organizations such as St. Joseph Community Health Foundation, Parkview, Good Hope Baptist Church to do the HEAL program. We also partner with Francine's Friend. We bring the services to the community. We are the organization that actually train those community health workers. And I was telling Dr. That he needed a community health worker. I was like, we need to get one in your office in order to do that, that survey that you're doing, because people have to live in a community, know a community, and look like the issue, look like the people, because you can ask those questions. But if you have you don't have the right person asking the question, they're gonna say, But if you have the right person asking the question, they're gonna answer it very truthfully, and you're gonna get what you need. We also collaborate with Parkview. They're bringing in the new Ronald McDonald Care Mobile unit. We're excited to be one of the sites that's going to be in to look at the education and examination and having those services available. And we also do research. We do research in partnership with Indiana Minority Health Coalition. We just finished a research piece on mental health, looking at self-help project. How can we actually use tools that we're able to be able to assist us when it comes to mental health? So what we're saying is we're a public health organization, we're doing things in the community, but we're not doing it with the public health money, okay? So we need some money. So our public policy, our local leaders, our state leaders, we need you to vote. We need some money, okay? And you know what? We live on the south side of town and we still pay our taxes. We need some resources there too. That's Health Visions.
Anybody want to clap for her? Yeah. I think I'll be simple to follow that because I like that. My name is Mike Ripley. I am an employee benefits consultant with Gibson. Some of you are probably more familiar with the term health insurance broker. That would be far too small of an explanation of what I do for a living. But to give you a really short and sweet is that I represent employers who are attempting to actually make a difference in their employment practice for these people. And why it's important economically, healthy people are happier people, healthier people are more engaged employees, healthy people are more productive employees, healthy people contribute more to their communities. So an employer that wants to be productive, engaged, remain in their community, contribute to their community, they actually care about the health of their employees. I know that probably in a lot of people's minds, it might look like an adversarial thing. Well, an employer just wants to pay as little as possible. Well, I don't think that's an unfair statement. Don't we all want to pay as little as possible for whatever it is that we get? Nobody jumps up and down and says, I'd like to pay more for no reason. However, what's happening is, when we talk about all of these things, I think, and I don't mean to say that anybody's remiss in this, but we haven't really said out loud just how incredibly expensive everything we've talked about is. And to be fair to employers across all of the United States, for working age people, employers are paying the majority of that bill. Now, take your political leanings aside, that's a statistical truth, okay? And what we need to focus on is, okay, we're going to pay that money. The Affordable Care Act said you are going to pay that money, but what are we doing with it? Exactly what Renetta said. Are we actually helping someone get healthy? Are we helping them be employed? Somebody who's sick doesn't work. So if I hire you and you come to work and you get sick on my watch, I paid to bring you here, I paid you while you were here, I trained you in job skills, and now I'm paying for your medical care. It's an absolutely unsustainable system. We are not going to survive that. And so as sitting here on the employer side of the table, I will tell you that the partnership, the desire for a partnership is incredibly current. That we need a partnership, but we all have to admit certain things to ourselves that, number one, healthcare is expensive. Number two, we've done a lot of things wrong in the past. And number three, what it looks like moving forward probably doesn't look very much like what we've done in the past.
Wow, I almost feel like my work is done here, so thank you. So let's start off with, from your perspective, what do you believe is the single biggest threat to health in this community? Why do you think that's existing, and what's the number one thing we should be doing about it?
Are we going to go in order?
You go however you like.
Okay. Well, of course I'm going to say tobacco. Though I could go a little deeper and talk about the reasons why people use tobacco and what we could do about that. I mean, we could kind of debate that, what comes first, chicken or the egg? Well, a lot of it is because they're responding to the marketing. I mean, the tobacco industry is spending $1 million a day to tell us this is a product we need, and it gets in the heads of our kids who are visiting convenience stores. So, that's where most of the tobacco is sold, is in convenience stores or discount stores, neighborhood stores. And the kids are walking in there to buy their soda, their chips, their candy, and what are they seeing? They're seeing just a landscape filled with advertising and discount pricing and pretty little packages all lined in a row behind the counter of the, when they walk up to pay for their stuff, they're seeing nothing but this power wall of tobacco. So it normalizes it for them. It tells them this is something adults do, this is normal. It gets them intrigued, and it happens all on a subliminal level. This is not something they're consciously thinking, but they're seeing it constantly. And we know from the research that kids between the ages of 13 and 17 are visiting a convenience store at least once a week. So when you add that up for all those years, that's a lot of exposure to tobacco advertising. So that's the huge thing. And then it's like you start playing around with it, and now they're marketing e-cigarettes aggressively. They're starting to play around with nicotine. They have no clue what that does to the brain. They have no clue how addictive it is. And they're seeing it as something just fun to try, not like this is a drug I'm going to get addicted to and it's going to have serious consequences. So there's all of that. People will say it's because of the stress, but the reality is nicotine does not relieve your stress, it increases it. The only stress that nicotine relieves is the stress of withdrawal. If people understood that, they'd get a lot clearer about what it is they're doing and how to get out of it, because it's not helping their lifetime stress at all. If that were true, tobacco users would be the most relaxed people on the planet, and that is certainly not the case. I always tell them that.
What do you think we should do about that, the marketing understanding the stress that this does place on you, what action should we be taking or asking our community to take, or our legislators that are here?
Yes.
Oh my,
So,
she has
okay, where did I put this?
a book for you.
So there is a little card out there on 2 of our tables, Tobacco-Free Allen County and also Tobacco-Free Indiana. Raise It for Health. Sorry, it's the Raise It for Health. We have a little card that's for saying, yes, I support raising the tax on cigarettes. Right now, the tax on cigarettes is 99.5 cents per pack. We're one of the lowest in the nation. We really are enabling people's use. We need to raise that. The average is about $1.71, if I'm not mistaken, nationwide and all around us. The states around us, except for Kentucky, are all higher. We've been trying and trying to get our legislature to raise this tax. They're loath to raise taxes. But this is a tax, they need to hear from Hoosiers that we support this tax. This is a good tax. It would increase the revenue that we can spend on all these other things we're talking about, for one. And then we need to return to actually funding tobacco prevention and cessation at a level that is actually somewhere close to what's recommended by the CDC. The CDC says Indiana should be spending $73.5 million on tobacco prevention and cessation every single year. You know what we're spending right now? 8.2. So we're way below where we should be. We were once spending, I think it was back in 2011, I'm not going to say when it was because it was a while ago, I forget. But you know, kind of when we were at the peak of our funding, it was about 32 million, which is still a long ways from where we should be. So we're just trying to get back up to that 32 million. We'd be happy for that, but we really ought to be at 73.5 million, and it would make a huge difference in how aggressively we can market the quit line. There's still tons of smokers out there. 70% of them really want to quit. We know that from surveying smokers, that 70% of them want to quit. They just feel trapped in it and they don't know how. And they've tried before and failed and they're discouraged. And addiction overrides, the impulse to use overrides the will to quit. So we need to do more to make it harder for them to smoke and also make it easier for them to quit and to know about the resources that are available. With more funding, we could do that. And of course, more prevention education.
I do feel a little undergunned. I mean, you've got all these statistics. I don't have anything in front of me. So I actually think probably the single biggest threat, because it really is all intertwined. I think all of this is the most relevant piece to this. But the apathy or the lack of focus on taking these things to the next level. And again, I'm here kind of on the employer side. For so long, we have been focused on just the pure cost of something. So what is the dollar sign? And we say, okay, I make a good dollars and cents decision about if I do this, it will lower my cost. But we don't think about the impact. So think about if an employer says, well, I need to cut 10% out of my health insurance budget, as an example. That really is saying I'm committing 10% less to the health of my employees. And now it's not a direct correlation always, but that could come in the form of the focus on preventive medicine. It could come in the form of the network that a provider is using. So, and Lutheran and Parkview folks are in the room, so I can say this, but how many of you know about a narrow network for insurance, that it's either Lutheran or Parkview? Anybody? No? Okay, so employers, in order to cut costs, need to often go to a single hospital system, which means they're saying to their employees, okay, hey, I get to choose the hospital you go to because I pay for this, and let's take all of any comparison between Parkview and Lutheran out of the question. Does it mean that they're going to get the right doctor? Do we know specifically that the right doctor for Mike Ripley's care is in Parkview's network? Or in Lutheran's network? Or maybe is in Canada? Or maybe is in Florida or anywhere else? That's what's happening, and that's happening because there's a lack of focus on what it is we're trying to do. So I'll cap that with the number one way for an employer to reduce the cost to their health plan would be to not have health claims, right? So focusing on the health of those people, the actual health, the medical health, the mental health, the physical, social health, will actually save them the money, but the investment has been really diluted and really kind of mixed up for a long time.
Well, I would say looking at what are the needs is, when I look at the people that I serve and the needs, we're looking at accessibility to service, awareness, continue to increase the awareness, collaboration with individuals and organizations within the community, because you can't do it by yourself. Collaboration is so important, in partnerships, and then education. But most of all, we need to empower the people that is impacting. You know, the people need to be empowered. You can do it. So, and what do we need to do that? We need some money, okay? So increase those taxes and give us some money, okay? We need money.
So let's pretend that your microphone has become your magic wand and you get one magic wish. For all of us here today, we want to improve the health of our community. We want to build a healthier community for our children. What's that one wish that would make that happen for our community today? You get one wish.
It would be to raise the cigarette tax by at least $1.50 or $2 a pack. Because with that, we would drive down the smoking rate. We'd get at least 50,000 Hoosiers to quit smoking, who are currently smoking. We would prevent about 40,000 teens from starting, because it would make it a lot less accessible to them. And we would probably save about 10,000 babies from being exposed to tobacco at birth, which we know some of the negative outcomes of that. And we would save employers a whole lot of money, because they're spending about $22 a day for every smoking employee that they have. So that right there would be a huge cost savings, just to get, you know, every single employee who stops smoking is saving that person a lot of money. It's also saving a lot of money to the public coffers, because we're spending right now, we are buying in Indiana I gotta look at this, in 2017, 62.6 packs of cigarettes per head, per every single one of us. You know, that's what's being bought in Indiana, and it's costing the public money about $16 for every single one of those packs in lost productivity and healthcare costs. So it would be huge if we could just drive that down. And cigarette taxing is the best way to do that quickly.
And with those taxes, you can use those dollars for public health, which is social determinants of health. And so that's what you're gonna hear. Resources, resources, resources.
I like having a magic wand. So my one wish would be that every child, and let's pick an age today, 18 years or younger, would understand every consequence of their decisions, on every consequence to their health for every decision they make moving forward. I think the struggle that we have, and this is true for all of us in the room, we have made decisions, bad decisions, sometimes good decisions, sometimes neutral decisions that have impacted our health. That doesn't mean that we're only a product of our own decisions about our health. We all have, you know, congenital things. We all have a background in our family history, but every single one of us has done something to negatively impact our health, positively impact our health. If we knew the consequences of those decisions in advance, then number one, it would be much easier for us to say, I don't want to do that. I'm not going to start smoking because that's a really terrible thing. I'm not going to try that drug at a party to look cool, because even though I'm looking cool is also part of my health, I want to have good self-esteem, this is going to destroy me. So many young people, and I would even say adults, don't get it. We don't get the impact of these things on our health, and we continue to make bad decisions. Part of that's empowerment, right? I absolutely agree with that. Part of that is we've got to give people the tools to do that. But if we had the power to use the resources in our communities, like our hospitals, like our medical providers, but also our departments of health, you know, all of our public services, if all of those things could combine, and again, go back to the focus side and say, we're going to tackle this, and kids are not going to be able to make it out of school without knowing what everything that they do is going to do to them.
Nancy, one specific question for you. Smoking's not new, it's been around for a long time, and you touched on this just a little bit, that many people believe smoking is my right. How do you respond to that?
Well, I suppose we have the right to destroy ourselves. I mean, you know, I'm not sure, I can't say that somebody has the right, does not have the right to smoke, but their right to smoke stops at the point where it affects me and my health, and every one of you and your health. So, and to some extent we can say, you know, do you really have the right to do something that destroys you if I'm going to help pay for your care? when you've destroyed yourself with it. So, you know, and we could go down that road. There's a lot of things we do than we help to pay for, but this is one of the most destructive things that anyone ever does that all of us end up helping to pay for. So, yeah, I think people have a right to make bad decisions. They don't have the right to impose those bad decisions on everyone else.
Renetta, you talked a lot about the work that's going on within the community that you serve with Health Visions. Can you share a little bit more as far as what you believe we need to focus more attention on or avoid duplication, where we really all come together and focus in this area?
Well, I would say that we need to place more attention on the things we're already doing. We see the oh, thank you. I would say the things we need to focus more on is the infant mortality, in which we're doing, and doing some great things with partnership with organizations such as Parkview Hospital, and also looking at the obesity issue, and being able to have additional resources so that people can be trained in the area of community health workers. We believe community health workers is really the way to go to impact the geographical area that I serve, the 02, the 03, the 16 area. We believe because if you live in that area, you know that area, and you pray in that area, you know what the needs are, and those individuals are the individuals that can help look at alleviating some of the issues there when it comes to the obesity piece, the infant mortality piece, the homeless piece, the diabetes piece. So community health workers would be the issue that I would definitely want to place more resources in.
Right, we appreciate your work with community health workers, and they're a wonderful asset to us, so thank you for that. Okay, Mike, we talked a little bit about being a healthcare organization and having coworkers that are unhealthy, and a lot of times employers would ask us, well, what are you doing around coworker health? How's your own population? You have 11,000 coworkers. Tell us how their health is. And I'm looking at the well-being team down here in the front, and we kind of would, why is it, Mike, that it is so hard to address our own employees' health? What makes that difficult, or what are the barriers, and how do we get around that?
I think from just a personality perspective, it's very difficult to be candid with those closest to us. So when we start to work with someone, when we get dedicated to a coworker, obviously there's an amount of, I don't want this person to feel bad because they're making terrible health decisions. But at the same time, I really know that they shouldn't have had that extra donut, or that they should have walked instead of driven, or whatever it might be. And those are really easy to key on pieces of health. But so it becomes almost restrictive to look to your right and say, okay, Sue, you need help with your health, but then next, I don't know how to help you. I may not have any idea. I mean, me personally, I'm not the healthiest guy that ever lived. I'd like to be, I'm not, but so who am I to sit next to you and say, well, Sue, you shouldn't have had that extra donut? Clearly, I've had a couple of extra donuts in my career, right? But the truth is, maybe it is something that actually needs said. So then there becomes this friction, and how do I overcome that piece? But then finally, I think the real issue becomes, it is expensive to be healthy. I know that some people will say, yes, you can do it on a budget and all that, and that's great, right? I don't know, and I'm speaking for the general person, I don't know how to eat healthy. I don't know all the safest places to walk. I maybe don't know how to get on the bus route that takes me to the safest places, things like that. So it's very expensive for me to say, I'm gonna make all of the right health decisions today, right? So you have this personal touch, you have the lack of information, and then you have this issue of the expense. So in the employment world, how this is being addressed, and some of you might know about things like this, but wellness challenges, which Gibson has really tried to get very far away from the idea of wellness. It's very vague. So we're trying to encourage our employers to talk about what type of health are you trying to address. Do you want to address someone's physical health? Are you trying to address their mental health? And as we do that, then again, we can be more focused. So enacting programs, Gibson, and this is anecdotal, but Gibson has our own internal wellness program, right? I'll call it that for you. But what we're doing are things that people are asking to do to improve their own health. I'm going to shock you with one. One of our wellness programs is a book club. Why? Because that's something that is very healthy for someone to do, to engage in imagination, to engage their peers, to engage the social norm of discussing something around the water cooler, right? Those are all pieces of the puzzle. And then finally, and I would be out of line if I didn't mention this, but employers are paying for clinics. How many of you know about an employer-owned or sponsored clinic in Fort Wayne? Well, there are probably 15, 18 maybe. And so all of us who work in the health field and related fields that don't know that there are that many employer-sponsored clinics, we probably should know, right? They're providing first-line primary care to employees and their families. And they are actually addressing primary care from the sense of what piece of your health am I attempting to impact today?
I'm going to pause right there. Thank you all very much. Are there questions from any of you in the audience? I think Jennifer will run around. Yes, Dr. Crawford?
Just want to make a quick comment and a question. I'm on city council here in Fort Wayne. In 1996, we passed the toughest smoking ordinance that still is in the state of Indiana to reduce secondhand smoke. We can estimate that saved about 1,000 people in the last 22 years from dying premature death. So there are things that we know we can do that will make a difference. Tobacco tax make a difference. Increasing prevention. Why doesn't that happen? Because it's hard. Anytime you try to change anything in Indiana, get ready, people are coming after you. The state legislators know this. When they bring up the tobacco tax, we usually hear from people that are against it, not from people that are for this. So if you're for that, you need to let them know you support that. The same thing. If you take the money for prevention, you're taking it from somewhere else. And you either have to cut somebody's tax, somebody's funding, or you have to raise taxes. That's smart. So they're going to get attacked for those changes, and you have to support them if you want to get it done. So Tennessee's told you how to do it, be sure you do it.
Thank you.
Are there other questions? Yes.
I have actually a lot. It's kind of back to what you were saying, Mike, about being healthy is expensive. And I really want to argue against that notion and against thinking of being healthy as an expensive venture. Maybe healthcare is expensive, I'll agree with you. But being healthy is not about just eating the organic food, but knowing how to eat. I think Renetta alluded to the making the right choices while you're shopping. And we need the education and that part and engaging the community, that aspect of it. And as an employer, I think there are many different ways that we can do to improve the health status of our employees and not put a lot of money into the expense that comes from not being healthy. From the book club is an excellent idea, little breaks here and there, or doing some of those educational things. So I'm just, when you said being healthy is expensive, I don't want us walking out with thinking that that is another hill to climb for a lot of people that have many different challenges or education.
Thank you. Yes.
To reiterate what Renetta said, I think that the community health work is a great idea. I spent a lot of time recently going around talking to people about e-cigarettes and not youth yet, but youth influencers. And I really feel that talking to people would be so much better if someone you knew. That if we could teach community health workers that someone you knew and that they would maybe understand that it is, a lot it's not just farmers or labor. So I think that is a really key piece that we don't always see, and that I think we're going to see a big movement with that in community health.
Thank you. Yes.
I just have a question about
the tobacco use rate, looking at California and New York are great examples because they've done an excellent job of it. And they've primarily done it by passing policies that are tough, make it harder to use, like raising the taxes. Very strong smoke-free air laws where, ours is pretty good at the state level, but we still make some exceptions. We are still saying in the state of Indiana it's okay to smoke in bars, which means that it's okay for the people who are working there to be exposed to that. And we know that secondhand smoke raises the risk of heart attacks and cancer and asthma and lung disease and all kinds of things. So it's not okay to say that if you work in a bar, it's okay to be exposed, but everybody else, the rest of us in our jobs, we're protected. So looking at some of those examples of where they've passed really strong smoke-free air policies, where they've passed tough taxing, and where they fund prevention and cessation at an adequate level. We actually get $560-some million a year in tobacco tax revenue and in the Master Tobacco Settlement Agreement money. So we have a lot of money coming in that really can be used for prevention and cessation, and it's been siphoned off to use for other things. So I don't know that it's all lack of money. I mean, it really is a lack of priorities. It's like we're deciding to fund this instead of that. And a lot of times we're deciding to fund things that are downstream rather than upstream. We could prevent the need to fund all these other things if we started here with the prevention. So prevention and getting people to quit.
Have you ever heard of the Blue Zones communities? No. There are various communities. Dan Buettner traveled the world to identify where are people living that live way beyond their 90s and what are the common characteristics. I'd encourage you to look at that. I encourage all of us to look at that because within there lies the key to how you create that healthier community. So Naples, Florida is doing that. Sioux City, Iowa has done that. Minneapolis is working on that. But it identifies different things within your community that creates that healthier lifestyle. It's advocacy, it's safety, food security, physical, mental health, but it really has some keys to success. To me, when you talk about a strategic plan, it's laying right there. It's just how do we come together and make all of that happen? I think we're out of time. Okay, Cassie, go ahead. That's all right.
I kind of work on the flip side of the coin. We've talked a lot about youth today, but I work with older adults, and so I guess Nancy, more directed towards you. I'd be curious your thoughts on where the greatest opportunity with older adults in smoking cessation or education or anything really would lie. What you kind of think about that, where you see the greatest need related to older adults in smoking.
I think a lot of times with older adults, it's the message. They need to hear the message that it's never too late to quit, because a lot of them will feel like, well, I've smoked this long, I've done the damage, is it really worth it to quit now? And they need to understand that, every single day that they continue to smoke, the harm that it's doing, and how every single day that they would be quit, the benefit to their body. So it's some education around that, and also the message that no matter how many times you have tried to quit before, and you may have relapsed or you just didn't succeed in quitting, that's just practice. It doesn't mean you failed. It means it's practice, and you just need to keep practicing, and you need additional support and information and access to resources that can help you quit. So a lot of times people don't know that the Indiana Tobacco Quit Line is out there, that they're really well trained to help people quit. They're very successful at it, and it's free to them. We're all paying for it. I mean, it's a publicly funded service in Indiana, so people need to access it. So that would be important, and you as somebody who works with them can be in the preferred network where you're actually referring them directly by fax to the Quit Line, and then the Quit Line contacts them. So if that's something that interests you, we can sign you up actually right out there at our table today. It's free, there's no downside to it. Just makes it easier for you to, rather than hand them, because a lot of times, this is the way addiction works. If I'm chemically dependent on something and that signal in my brain is driving me to use it, and I'm standing in front of you and I'm hearing about, the reminder that, yeah, I really should quit, and it has all these consequences. In that moment, I might say, yeah, I want to quit. And so you hand me a brochure, you hand me the number, you give me that information, I walk out. What's louder when I get home? What's louder is the chemical message in my brain saying, get this. And then I start to go, well, maybe I'll call tomorrow or the next day or whatever. if I can be captured in that moment where I'm feeling, yes, I do want to do this, and I'm feeling your support right now that I can, and say, okay, I'm going to sign up for it, then I know the call is coming, and at least that takes it out of my hands and makes it a little more likely that when that call comes, I'm going to actually say, yes, I want to do this. I am committed to following through with it. So that's a really important thing too, and not enough people know that you can actually do that you can fax refer. Employers can do that, healthcare providers can do that, social service organizations can do that, and it really helps make it happen. So that would be one thing.
Okay, I don't see any other questions. One last comment for each of you.
Great. So I have a plug to make in all of your bags. There should be this flyer. We have an event happening next Monday evening where we are going to be talking about the tobacco marketing to youth in this county, because we have done a project over the last few years of actually surveying. Our community coalition's been involved in this, and some volunteers, surveying the local tobacco retailers and getting information about how tobacco is marketed locally. We're going to be presenting that data so you can learn more about what is actually happening right here. And we'll have a panel of youth and youth leaders, some health leaders who are going to be talking and responding to some of that information. We'd love to have more people there. It's free. The information is on here about how to sign up. We do need people to register because we're serving food, so we need to know how many people. And the other thing is we always need more community members involved in our coalition. We are a community coalition. Staff does a lot of this work, but we also need the support and help of community members, and we need your ideas and input. There should be this flyer also in your bag, and that tells you how to contact us if you'd like to get involved. Thanks.
Well, thank you for inviting us and listening to the services that we offer. We encourage you to contact Health Visions at 745-1600 if you want us to come and educate you on issues that impact your community, impact your church. We also want you to continue to call your legislators about the issue that we're talking about today. You know, there's some in the audience, but they're not here, but they need to hear from you. And also send them a little note and encourage them and thank them for the work that they're doing, okay? And let them know that we know it's hard, but it's harder for us too. So thank you.
I just challenge all of you, all of us in this room. We have some connectedness with the health field, with the future health of our community, and we're all invested in it. But I would challenge you to be courageous when you're talking to other people who are not connected to this, who don't walk through life every day thinking about how can I help someone else be healthy, or how can I help my community be healthy. Don't lose the passion or the excitement or the vision for what it's like for other people to be healthy. Really drive that home. We're all going to have challenges when it comes to moving this to the next step and moving it to the next step and the next step. But remember, we can make an impact on it, so let's decide that we're going to.